I didn't look at it like I was depressed, like that's a mental illness. I didn't look at any of that like it was a mental illness. I never did. I never saw any of that stuff. When I was flying around and manic and, doing this and doing that, going to this job, going to this, I didn't look at any of that as mania or any type of mental issues. I drink a lot of beer and calm down, or I do a lot of coke and I'd be up and I wouldn't feel bad anymore.
When they said I had a sickness and a disease, it was like a sign of relief, because I was like, man, something wrong with me. All the time I was blaming myself for everything I was doing, but I didn't realize that what I was putting in my body was causing me to become sick and sicker, and the disease was really getting worse and worse.
And it wasn't until I started working as a social worker in the mental health field that I started to say, oh, these are the things that I'm helping people with, the symptoms or the progression of their illnesses, and all along I have the secret life that I'm experiencing a lot of the same things. At the same time I'm drinking and don't even realize that that's part of the problem.
The one thing that we know about folks with co-occurring disorders is that if you treat just the addiction piece and not the psychiatric piece, the whole person gets worse. And if you treat just the psychiatric piece and not the addiction piece, the whole person gets worse. So we know we have to treat both things at the same time if people are really going to become well.
Addiction and mental health professionals nationwide have been searching for an evidence-based model that integrates the treatment of addiction and mental health disorders. Introducing the Hazelden Co-Occurring Disorders Program. Developed by the faculty of the Dartmouth Medical School, creators of the IDDT for severe mental illness, and the DDCAT, a program assessment tool, the Hazelden Co-Occurring Disorders Program offers clinicians a new, comprehensive, manualized treatment for co-occurring disorders.
We initially were concerned about community mental health issues, and so we were studying people with mental illness and trying to understand how to help them avoid the really negative outcomes that tend to happen with people with mental illness. So for several years we studied trying to help people stay out of the hospital, help them stay out of homelessness, help them avoid suicide, help them avoid incarceration. And all of those areas led us to the issue of substance abuse. It turns out using alcohol and drugs is an underlying issue that creates all of those bad outcomes for people with mental illness.
The Hazelden Co-Occurring Disorders Program includes the Clinical Administrator's Guidebook, as well as the following curriculum: screening and assessment, integrating combined therapies, cognitive behavioral therapy, medication management, and the family program, which includes an educational DVD for patients and family members.
The family is a system, right? One component does not work without the other component. And so we try to figure out how our family members arrived at this point.
All of their Christmases, I was always sober. Every holiday, I did the things that mothers do. I tried to set a good example. But somehow or another, you still fail. Where did I go wrong? I keep asking, where did I go wrong? This was my first child.
Co-occurring disorders affect everybody in the family, not just the individual with the disorder. And in a related way, other family members can have difficulties in terms of depression, in terms of the stress of coping with a member with a co-occurring disorder, frustration, guilt, blame. Having a family member with a co-occurring disorder can create a lot of stress in the family. Right. These programs are designed to help family members, including people with co-occurring disorders, develop effective skills for managing co-occurring disorders, for decreasing stress in the family, and for helping everyone pursue personally important goals.
We know from 30 years of research that people who have co-occurring disorders that did not get integrated treatment did very poorly. They just weren't able to recover from their disorders as well and suffered a lot of negative consequences, and their families really suffer as well. Now we know that people do better when they receive treatment that's integrated, where they get the same kind of message from their treatment team about what can help their co-occurring mental health disorder and substance use disorder. So integrated treatment really means that people get treatment for both disorders at the same time from the same people.
What we've tried to do over the last 20 years is to think about how can we simplify these effective treatments and make the training available to clinicians so that they can provide effective treatments more easily.
We're giving these people a chance to get their lives in order, to get their families back, to have their children reintroduced into their lives, to get jobs, to go to college, to have the things that they're entitled to have. And all they need to have these things is the treatment and the medicine and the counseling that they need, and frankly they're entitled to have.
People want lives. They want to have families. They want to have children. They want to have jobs. They don't want to be in and out of treatment centers and hospitals. That's not the life script that they would write.
It's not a death sentence to have a mental illness or a substance abuse problem or both. You know, where do you find meaning in your life? What brings you joy? And then how do you work your way out of that hole that you've gotten yourself into? And people have said, no, you're not going to get better. I know what it's like to hear, I'm not going to get better. Luckily, I had a little voice in the back of my head that said, no, I don't believe that.
Thoughts come and they go, you know, and I replace them today. When, see, contrary to belief, when things come to my mind that I know ain't right, I flip the script in my head. I flip the script. I just don't entertain it no more.
The Hazelden Co-Occurring Disorders Program is the first evidence-based model to integrate the treatment of addiction and non-severe mental health disorders, offering the promise of recovery to individuals and families.